we have this problem. No. The problem is that I need to take out. We have different situations. We have coffins, the animals have tachypnea, the animals have that. Later we are going to see the videos, but now I think that it's better to sound, to know the sound of the coffins. Okay. It's missing because they have different significance. Okay? Coffins are pneumonia. They have pneumonia. When they are productive, are very important lesson. This is a productive. Okay? Now, we are going to see the videos that we sound now. This is the videos that but it's impossible to put at the same time. Sorry. This is a clinical science, a classical clinical science, animal with fever, anorexia, nasal discharge. In this case, it's a pulmonary edema. These animals die. When you found this animal that is with weakness, but it's pulmonary edema, this animal, you can do anything. Okay? They're going to die. Atropine is one up to, that is not possible in Europe. This kind of dyspnea is very common in chronic forms, okay, but it's not normal to found animals to this way. These animals is chronic sick, it's very difficult to report, okay? Are very different situations. Sneezing that the animals is very typical to found mainly during the time of the oestrosobis and during the time of the ammonia, or when during winter we have this kind of lipids, more ammonia than we need. Okay. And furthermore, the dust that could be produced by the wind, but at the same time could be produced for the breakdown of the granulate field. Okay? And the coffins that are in the video. We can use other kinds of diagnosis. Okay, diagnosis by ultrasound, pulmonary ultrasound. You can help here. Okay? All this discotheque. My students say we are seeing a discotheque. Okay, because all these things are different movements. There are different types. Okay, and we can use TAC or CT, okay, but it's only for investigation. It's not useful. Furthermore, pulmonary ultrasounds in the real life for lungs is something very well. Only for some situation to produce animals that go to experiments or that go to the some kinds of products. Very low. We don't use because the cost of you need special kits to do that. It's not you can do with the same ultrascan or the same scan that a normal gestation, for example, or pregnancy diagnosis, but we need better scans, but it's possible, and you obtain a very good result. Speaking about the clinical diagnosis, when we are speaking about the clinical diagnosis, we made a study in the Zaragoza University with our students, in where we have more than 200 labs, okay, including that. According to the clinical examination, the clinical signs are present or not, and later we always slaughter the sheep or the lamb and revise the pulmonary lesions, okay? And when we do a clinical examination, clinical signs are present, and pulmonary lesions are present 10%. So, if you say that in clinical examination that this animal is affected by ORC, it's perfect. You're always right. However, when you say it's not affected, 61 of the animals that you say that are free of ORC have pulmonary lesions. 61%. So, and you fail more than you are right. It's something that is very important. You have a sensitivity around 53% with clinical signs. If you added auscultation to this clinical sign, you increase your sensitivity to the 65%. And if you include the pulmonary scan, you go to 98%. Only at less than 10% of the cases you face it, okay? The most problematic situation is that you are very good at severe cases, but you don't know if these animals have a mild or a moderate situation that they have pneumonia lesions, but they don't have clinical signs. Okay? It's very important to understand. Okay? Clinical diagnosis with pulmonary ultrasound is perfect, but it's not possible in real conditions. So it's not possible with spreading fluid. You could do that with a very value animals, but it's not a routine technique. Okay, very important. ORC lesions. We have three main kinds of presentation. Septicemic lesions. The most important thing is in the you can find congestive foam or hemorrhagic foam. You can find here, and you can find a lot of hemorrhages in the subcutaneous area. Okay, and you are going in the most of the damage are concentrated in the upper airways. Okay, in the upper airways. You can find the hemorrhagic rhinitis. You can find these lesions around the throat. All of these areas that you can find here are necrosis of the lymphoid tissue. This is the tonsils. This area have a very important part of the lymphoid tissue. Okay? And all this is necrosis produced by toxins of the bacteria, and if you revise the lymph nodes, in this case retropharyngeal lymph nodes, they are enlarged and hemorrhagic. Okay? And furthermore, we can find this same necrosis of the glottis in the proximal portion of the esophagus, because there are some lymph tissues there. Okay? Always necrosis. You can find all these hemorrhagic areas, enlargement of the prescapular or thoracic lymph node, and thymus present hemorrhages, insecticemic, a lot of hemorrhagic, a lot of vascular damage, but the lung is not affected. They present hemorrhages, they present congestion, they present edema, but they don't present consolidated lesions. Okay? In the septicemic form, the lung, the low airways are not affected. Okay? It's very important. We can find hemorrhagic or congestion in meninges, and we can find huge hemorrhages in critical. It's not in myocardium. It's not. Okay. Septicemic lesions, vascular damage. A lot of congestion, low proportion of lesions in the lung. Okay, and the lung is always congestive with hemorrhages, edema, but without consolidated lesions. Very, very important. Necrosis of the tonsils and epiglottis, rhinitis, encephalitis, and cardiac hemorrhages. Okay, that is the summarizing the hemorrhagic forms. Okay, and when we are speaking about chronic lesions, we are speaking about other things. We are speaking about animals that are very thin. We have enlargement of the lymph nodes, but we don't have hemorrhages. Okay. We have the lesions always in the lower area. We don't have problems of rhinitis. And always we have consolidated pneumonia lesions. We can find in this case a very beautiful case of a interstitial pneumonia. You can find that these lungs are very big, okay? But you find that in other areas you have cathedral or suppurative or productive, now is productive pneumonia, okay? And find a lot of adhesion, and some cases you can find abscesses in your lungs, and in these cases you can find renal amyloidosis affecting to these animals. So there are a lot of different things, adhesion, more adhesion, but you see that the congestion is very low. These cases is not important, the vascular damage. It's the opposite to before. Okay? In brain we can find pus in the different areas, in pericardium we can find fibrinous pericarditis or fibrin pericarditis, and these are the normal chronic lesions. In the most of the cases we found in interstitial pneumonia, furthermore the typical pneumonia that you can find in many cases. Summarizing, damage is concentrated in the lung. Okay, we have the possibility to have abscesses, renal amyloidosis, fibrinous pericarditis, pleural adhesions. Okay, that is chronic. And when we are speaking about acute lesions, huge, in the middle of both. Okay, everything that is in the middle of both. We can find these typical lesions with more congestion than a chronic form, okay, that could produce some fibrinous, more fibrin, even more fibrin, and a lot of fibrin. Okay? You can find a lot of fibrin in everything. At the end, we know that the fibrin changes to fibrosis in around 2 weeks. Okay? Less than 2 weeks, around 2 weeks. And we take that over more than 5,000 necropsies in lungs. Okay? Around 50%, a little more than 40% of acute forms present fibrin or fibrosis in the lesions. And in the chronic forms, a little lesion, and in septicemic form is anecdotal way to find. Okay? But it's very common in acute forms to find necrosis, as for example that is related with Fusobacterium necrophorum. Is something very common to find in lungs. It's not very difficult. Okay, you can find a lot of liquid in the thoracic cavity, pus, or different. There are a lot of different lesions, but the most important one is that here there are always congestion. Is the difference with the chronic waves. Here we have always congestion. Okay? You can find fibrin even in the magnum hole, and rhinitis that could be fibrinous or could be only hemorrhagic, congestion in meninges, fibrin in the pericardium, and necrosis, but it's a necrosis that presents contamination in glottis, an empty glottis. Okay? You can find a difference with the acute or hyperacute forms. They don't have contaminated gut lesions. Now in acute forms, we have contaminated and we have more extensive necrosis. Okay? This is a hyperacute form, acute form, and chronic form. Okay? We have these three patterns, or three patterns. Okay? We define that. Okay, but we need to take samples because we don't know what is the etiology of these lesions. And the samples could be taken in vivo, bronchoalveolar lavage, that could be entered by nostrils. This is the case. We put the proper catheter around 30 centimeters or 40 centimeters, depending on the size of the lung. We introduce this catheter always up in the nostrils, always up. It's very easy. Introduce around 20 milliliters for this kind of animals. It's around a lamb of around 20 kilos, more or less. 20 milliliters, and you need to recover around 3, 4, 5 in the best of the cases. You recover around 2-3 seconds. Okay? You don't need to wait a lot of time. Okay? You recover and you introduce this sample in epidurf that you send to the. Okay, this is one possibility, bronchoalveolar lavage, nostril entrance, and this other one is bronchoalveolar lavage with trachea entrance. Okay, it's a little bit different. Now we need to raise the area, clean to raise, to open a little place, introduce a trocar, introduce by the trocar the catheter. In this case, the catheter is shorter. You need to think that you cross in place, okay? And you recover around 3, 4, 5 milliliters in the first position, okay? You introduce and you set, okay? Okay, this is the most typical sampling way in vivo, okay? But what is the problem? The significance of these results, okay? We could think that it's a good result, or we could think that it's a good result. So for the reason, we developed 2 studies in the university. One of them with 100 seats, okay? And we obtained these cases, so these data. We have 2 different lesions. Productive pneumonia, fibrinous pneumonia, okay? We have two kinds. The first thing that we have here is that we make a bronchoalveolar lavage by nostril entrance. It is more contaminated than the rest of the sample. So when you introduce by the nostrils, you take a lot of bacteria that are in the nostrils, are not related with the problems of your lungs. Okay? Very important. If you are trying to know if the Mangenia molytica is significant or not in your cases, you see here that nostril is lower, trachea lower, and the biggest one is in the lung. So the the cases to control the level of Mangelia molecular in your cases is not very good, okay? Because in the pulmonary parenchyma, you can find more Mangelia molecular than the other techniques, okay? So it's not very good. However, when we are speaking about the Pasteurella multocida or when we are speaking about the mycoplasma, if you use bronchoalveolar lavas with a tracheal entrance, you obtain a very significant result. Could be a good option. However, we made the same study with other kind of animals, lambs, and we use other kind of evaluation. We have the parenchyma, and we try to find the concordance between the results obtained by a bronchoalveolar in nostrils with the pulmonary parenchyma and the trachea with the pulmonary parenchyma. And the concordance in the case of Mangelia mollifica is very low. In the case of the Pasteurella multocida is low, it's less than 50%. Trachea, 2. Both are not very good to have a good concordance with that, okay? And the problem is that we make that for cultures and for PCR, okay? For PCR technique. And both cases are no, okay? Are better for the parainfluenza virus, but it's not the best, or it's not the main ideology that we are going to find. And the concordance is always lower than 60%. And with that kind of concordance, it's very difficult to decide one treatment or decide one way to control by vaccination. So it's interesting that now that the bronchoalveolar lavas maybe is the only unique option in some very valued animals, but it's not the best option. Okay, we need to work with other kind of samples. And post-mortem sampling is the most common one and the easier for us that work with disease that are affecting to the flock, not to the animal, to the flock. Okay, and in this case we need to remember septicemic lesion, acute lesion, and chronic lesion, and we need to take the sample according to. And we are speaking about hyperacute lesion. The samples need to be taken from regional lymph nodes. Okay? The regional lymph nodes. We don't not take any sample from the lung. We don't have damage. In the hyperacute forms, lymph nodes. Okay? Brain. If you find pus in the brain, it's always a very good sample. In this case, it's swabs. Don't send a brain because it's very difficult to obtain any result. Always swabs. When you have pneumonia, when you have a pneumonic consolidated lesion, in that case, the best option is to send the lung. But you can send refrigerated or you can send frozen. If the animal is died by the viral respiratory complex, mycoplasma, the rest of the bacteria could be cultured without any problem if the lung of the sample is frozen. Don't have any problem. So if the day is, I don't know, the day before that the lab is closed, you could frozen the sample without any problem. Okay? And when we are going to the abattoir, to the slaughterhouse to take samples, always we are going to take lungs and always refrigerate. Here we have less amount of bacteria. If you frozen them, you can. Okay? Very important to understand that. And with that, we have these data. We have data for more than near to 4,000 isolates from animals died from different ovine respiratory complex, and all these cases were taken, or these are the results, and the most important one are these 5 bacteria, and are the Pasteurellas, Mycoplasma, and E. coli. And why is important E. coli? Because E. coli produce fibrinous pneumonia similar to Manheimia monitor. But only you need to think about E. coli when this culture is a pure and massive culture. If you find E. coli with Manheimia monitica, with Pasteurella monitica, or Pasteurella multocida, and Mycoplasma, most of the cases is contamination. Okay? But if in a massive and pure culture, could be an fibrinous pneumonia produced by E. coli, and they have the same lesson than a Manheimia monitica. So for this reason, before we are speaking about the practical approach, it's not possible to distinguish between them. Okay? Always speak about one level. Okay? And we have to center our work in these 4 bacteria that are the Manheimia monitica, Vibestenia ceanosi, Pasteurella multocida, and Mycoplasma, many of the Mesomycoplasma ovinum. Okay, you can see that the proportion of Manheimia monitica and Pasteurella multocida is very similar. It's something that is very important. But it's very important to understand that all of them are part of our microbiota. It's normal to find it in a health seed. So it's very important to understand that. And the nasal cavity and the nostrils, we are going to find Manheimia monitica without any problem. In the throat, Manheimia monitica Vibestenia ceanosi, and in the lungs, Manheimia monitica Pasteurella multocida and Mycoplasma. So it's part of our microbiome. But it's very interesting to know this other stuff. Ovine Manheimia that produce lesion has the same phenotype that the Manheimia that is part of the microbiota. So is that microbiota become pathogenic? Okay? But it's normally there. So it's very important to understand that. That means that when we are speaking about Pasteurellas, we can't speak about carriers. I take out Mycoplasma because it's a little bit different. But Pasteurellas never has any carrier. All animals are carriers because microbiota contain this bacteria. Okay? They don't have carriers. The most important thing is that the etiology in the most of the cases is mixed. You can see here that the most common culture is 40% of the total of the cultures were Manheimia monitica plus Pasteurella multocida. In other cases, Manheimia monitica plus Pasteurella multocida plus Mycoplasma. So you can find different combinations. At the end, around 80% of the total of the cases of ovine respiratory complex involve these 4 bacteria. So if we need to work against them. Okay? But it's a little bit more complicated because the items involved in the most of the cases several species at the same time. So it's something very important and are part of our microbiota. So it's very important to know that we can stop that our animals have this bacteria. We need to try to get the equilibrium to avoid that this microbiota become pathogenic. Okay? Very important to understand. And there are many relationships between the different bacteria. For example, Mycoplasma, when it's present Mycoplasma, the proportion of Vibestenia ceanosi is the same in the sample. The cultures are not affected by the presence of Mycoplasma according to the data of the Vibestenia ceanosi. However, when we are speaking about Mycoplasma plus Manheimia monitica, the presence of mycoplasma tends to improve the presence of the Mannheimia, but it's not significant. And in the case of Multocida, it's very clear significant. Mycoplasma increase the probability to find Pasteurella multocida for more than 2 times. So, in the cases that you find mycoplasma, you are going to find Pasteurella multocida in the most of cases. Okay? There are combinations that you need to understand. But it's a little more complicated. Why? Because Mannheimia mollitica have a lot of serotypes. For example, this is the case of our group. That is the serotype that were found in animals died by ovarian respiratory complex. The most important one, or the most frequent, was H2. This is the most common one in the worldwide. Okay. However, other group in Madrid, in Spain, but working with slaughterhouses samples, no necropsy, no slaughterhouse samples, obtain other results. H2 was less frequent than H7. So, depend of the place that we take our samples, maybe we have differences in the serotype. And furthermore, in more than 25% of the cases, more than one serotype is found in the same lesion. So we have a lot of serotype, and all of them are mixed. So too much, okay? We have some ideas to use in our working day, okay? And that is, in septicemic cases, we found mainly in suckling lambs, in lactation, we find animals affected by Mannheimia mollitica in pure culture, okay? And Vivestenia trealosi in pure culture for fattening lambs. It's a little bit different, okay? And when we are speaking about acute, the most common one is Mannheimia mollitica for suckling lambs, and the most common one in the fattening lambs is Mannheimia mollitica plus Pasteurella multocida, both at the same time. Okay, and in chronic form, the most common one is Pasteurella multocida in sucklings near Mannheimia mollitica, and in fattening lambs is Mannheimia mollitica plus Pasteurella. We have differences. The Vivestenia trealosi is only affected to the fattening lambs. It's very, very rare to find it in suckling lambs. And we have the Pasteurella multocida that is more important in chronic form than in acute form. And the culture, the Mannheimia mollitica, is more important in acute and in hyperacute forms than in chronic forms. Okay? It's a little bit a way to control, or the way to work in our daily work. Okay? We are going to finish. We have only 2 more. And it's very interesting to know what is the viral role in all of this etiology in the ovarian respiratory complex. We have a work in which we were evaluating 3 viruses, parainfluenza virus, syncytial virus, and pestivirus. Okay? And the data during the lactation was 15% of the total of lambs were affected, or were seropositive. To syncytial. In the fattening lambs, syncytial were positive 38%. And during the fattening period, this animal seroconvert, so change the status to be free of antibodies to seropositive antibodies in 36% of the total of lambs. And P3 or parainfluenza virus was most common in suckling lambs during lactation, but was very important in the fattening 22, and cell conversion was reduced because many of the lamps that arrived to the fattening to the filter were positive, so they can change their positive state. Pestivirus, in this case imported virus, the proportion was higher in the farms, in the saplings, than in the filter, and the seroconversion is very low. However, it's very important to know that the only one that affect to the health status of the lambs were pestivirus. So it's very interesting. And we need to know that these viruses are combined. Not only affect one virus to one animal, no. They are combined, and you find that parainfluenza virus are positive to the syncytial virus too. So it's very common to find different combinations. Okay, it's not very. And in the case of the pestivirus, we have other study that was before than that, and was that we evaluated by ELISA the presence of border disease virus in a field. However, the data make that it's very low, only 10% of the data. Okay, and that food were around a very big amount of animals. Similar to the 30%, we have a very low proportion of positive animals, but many of them have some amount of antibodies, but it's not enough to be considered positive. Okay? But when we do this diagnosis by PCR, we obtain other kind of results. We obtain that many animals were affected by PCR by pestivirus. You see here, any of them were affected at the beginning. That means that are no infected persistent way. No, they become positive during the study because this is the acute infections of border disease. It's very common in our field, okay? And they become positive, but they need time to produce antibodies. So for the reason, the time is not enough to be considered positive. If we make a study, they become positive. Okay? So for the reason, we have less amount, but these animals that were positive have a very high influence in the health status and in the weight. They reduce the weight in the animals that were affected by bodies. Okay, so it's very important the pestivirus in the feedlot, but the proportion of animals that are affected is lower than that. Okay, but it's like that. And with that, we are going to summarize very fast. We have different clinical diagnoses with clinical signs, with rotation or with pulmonary ultrasound. Okay, and we obtain them different results. Lesional patterns, epithemic, acute, chronic, and the samples. In vivo is a not very good option, but maybe it's the only one if you have a very value animals. Okay? We need to remember that many different species could be affecting the same animal in the same time, so it's very important that. And that bacteria and virus, they are all different, no? Pasteurelacea are the most important one. Mycoplasma increase the probability to suffer other kind of pathogens. Virus, the most important one in clinical outcomes are the pestivirus. However, the syncytial virus are very and parainfluenza are very present in our fattening glands. Okay, so all that ideas that we have, and later, now we are going to the breaking coffee break, and later we are finished with the treatment and the prevention practices.
Okay, well, thanks, Jose Maria, for your presentation.